Good evening. I'd like to call the July 2nd of the Board of Health to order. The first thing on the agenda, as always, is our citizen participation. Do I have any citizen participation? Go ahead, Mark.
Happy early summer, everybody. Everything's going well so far. Just making sure. I heard the news, local news. This is going to be to Raji there. Has there been any contagious cases of measles here in this town?
Mr. Mark, no, not I'm aware of, no.
That's it.
Thank you.
Okay, so the next thing on the agenda, we have 27 Dean Road, septic design. Is there anybody here from 27 Dean Road?
And
Okay.
Mr. Berman, you know, I can brief the board on the situation, what's going on.
Sure.
So this was a couple of months back. We did soil testing on this property. There are power lines, you know, running through the property, and Eversource have an easement there. The engineer, Paul Saunier, we have worked with him a lot. I asked him to get clearance from Eversource, you know, because of the easement. And then they submitted the plans. And last week I spoke with him. He asked me the status of the plan. We are almost at the approval, but he didn't have anything from Eversource, you know. So, and I asked him, like, hey, I cannot approve the plan till I have clearance for the easement. And this is when it came, you know, that he wanna come in front of the board to discuss that. I tried reaching out to him Friday, and in fact, this afternoon, you know, I was not able to reach him. That's probably that's why he's not here. But just wanted to bring it email in which they have very clearly stated, you know, writing that yes, they have to contact them for the easement part, and then they have asked us, you know, as Board of Health or even town, to not grant any clearances, you know, to them till they have clearance from Eversource. So that's
Raj,
all.
Okay, yeah, Raj, tomorrow, can we send a letter to the homeowner and to the, what's his name?
Mr. Paul Saunier.
Yeah, can we send that in writing to them so we have some documentation trail?
We'll definitely do that, sir. Yes.
Okay. Does anybody else have any questions for Raj on that?
Done.
Okay. All right. So the next thing on the agenda is easy convenience, tobacco sale to a minor. Is anybody from Easy Convenience here?
Yes.
Can you just identify yourselves?
Yeah, my name is Binta Mode, and I own Easy Convenience Store, the national. Yeah.
Okay. Raj, do you want to start this?
Yes.
Yes, thank you, Mr. Berman. So yes, Easy Convenience was one of the three tobacco retailer there where there was sale to minor. This happened last month. I know Family Dollar was in front of the board already, and Easy and 272 Pond was on this almost the same day of our board meeting when this violation happened. They have paid the fine so far, but whatever questions board have, or you know, regarding the sale.
Sure. So I have a question for the store owner. What have you done now to prevent this from happening again?
We train our employees so not happen again. We all the time the selling the tobacco product or wine product. So we pop up the screen. So give ID or the.
So if I may add this, sir, like I'm her husband, I can translate. we have
Sure.
added a feature. We have
Feature,
added a feature on the POS itself. So anytime the employee is doing a sale, like you scan a tobacco, wine, or a beer item, it will pop up a screen where you have to enter in a birth date to proceed with the sale. So once that birth date is entered, the sale will proceed, and that prompts employee to ask for the ID. That's one change we have made, and we have showed all the different kind of IDs that are valid to the employees that are working there. Like you need to have, these are the only valid forms of ID which are acceptable by state for this sale. So they have to look like where the dates are. And then there is a constant reminder on the screen too, like anytime, any sale, you have to ask for ID. And we have planned to repeat this training every 3 months in case, say, if someone is off and if someone is covering for, they all should be aware. So it's a plan to train everyone at 3 months interval.
Thank you for that. And I just want to read it. I'm sure some other board members may have some questions, but we as a board take this very seriously. And I think, if it happens again, the fine structure is significantly much higher.
yeah, we vocalize that.
Okay.
Yeah.
Sorry, go ahead.
So this was like we both operate stores in this Metro West area, and this was a new store. We just took it over, and we were in kind of rush to set up everything. And this, like again, employees were kind of like new, and employees just cover part-time. Most of the time, it's either me, her, or the other partner is present, and we are very active in that. But again, we are sorry this happened, and all of us, like as a team, we were all like, how can we not let this happen again? Since we sell beer and wine, and we don't want any minor to be involved or get these. So we are taking all the steps. We are adding. Actually, today I added one more additional sign itself on the door, where it says that if you are underage, you cannot buy this stuff. Just right at the entrance of the door, we added a sign today.
Great. Any other board members have any comments or questions? You're KG, I think you're muted.
Yes. Yeah, I presume you have made copies of the possible IDs available for the staff to see it right
Yes.
at the counter, so they know
Yeah.
what possible IDs are possible. Okay, that's good.
Possible IDs, and then there's a counter on the register itself where it says like this date is the valid date. Again,
Good.
once you enter the date, it will tell you. But again,
Okay.
just looking at the ID, you can say like, okay, before this day, or that kind of a setup, like a deadline date is on there.
That's good.
And sir, I just want to add one more point. I know just you said you posted something on the door and you said 18. It's actually 21. So I just want to make sure that
It's my slip of tongue. It's obviously 21. Yeah. Because I've been in this business for a long time, so it's 18. It used to be 18, so it always comes to 18, but it's 21. Yes, I agree.
I just want to make sure I got that.
No.
That you probably said it by mistake, but just want to clarify it's 21.
I'm sorry I said that by mistake. It was slip of tongue because all these years you've been 18, and then past 7-8 years it's 21. So it always comes as 18, but it's 21. I agree, sir.
Thank you.
Well, we as a board, I'm sure I speak for everyone. We want to thank you for being so proactive since the violation. And does anybody else have any other comments?
I don't, Ed, but just for the record, I had the same question as you, and I'm satisfied with the answer. So thank you.
Yeah. And again, in you as a business, if you have any questions or concerns, please reach out to Raj directly. He's always available. He's very helpful, especially anything Board of Health issues he can assist you with.
Yes, definitely. We will reach out to him. And he has been helpful since we started. So
Yeah.
he's a good help.
We are here to guide you people, not penalize.
No,
Yeah.
please, sir. Thank you.
All right. Well, thank you for joining us tonight. Next thing on the agenda is 272 Pond LLC, the Mobil Mart. Same thing, a tobacco violation. And do we have anybody from that store on? No. Raj, were they supposed to? Were they scheduled for 6:20? We're running a little ahead of time.
I see there is somebody named Pankaj, it might be the one, who have joined
Oh.
us.
No, this Pankaj, I'm part owner for the Easy Convenience as well, so I joined for the same hearing.
Got it, sir. Thank you.
Okay. All right, so we can come back to that. Why don't we go to the next thing on the agenda? Jay, it's for the RAM clinic update.
Yep, thanks, Ed. So we're doing well, moving ahead. So we're getting close. Setup is on August 9th. And of course, the clinic is on the 10th and the 11th. We'll probably be in Keefe Tech on August 8th to set up some of the food-related items in the kitchen. So we're going to start talking to Keefe Tech and just go through some logistics and that sort of thing. But in general, volunteers are signing up. They're registering. Dave and Ed, you'll be happy to know that as far as optometry goes, I checked the registration this morning, and it looks like we have a bunch of folks from the Mass College of Pharmacy and Health Sciences. So we have 2 faculty members. So this is for optometry. 2 faculty members, 6 students, and then there are 3 other folks that are either doing optometry, or I forget the other term that's used, but basically sizing people for glasses. So we've got 3 of those. So I think that if we had 2 more people doing vision care, that would be great. But even if this is all we had, I think it would be probably 2 more folks than we had last year. So that's we're in good shape. The other news is that we're increasing the dental capacity from 7 operatories to 10. So last year we had 7. We planned on 7 this year. We're going to increase by 3, and we've got plenty of dentistry staff to help us out with that. So we don't have to do any recruiting for dentistry. Let's see, I found out yesterday that the U.S. Public Health Service will be sending 15 officers to our clinic. And these are usually medical professionals, in some cases, veterinary professionals, if you have that offering at one of these RAM clinics. But doctors and dentists and medical folks, often they'll do this for training or as part of getting clinical hours. So they have confirmed that they will have 15 people on site. What I haven't heard yet is that we're responsible in any way for housing them. I hope that's not the case, because we weren't prepared for that. It doesn't look like that is going to be something that we need to do. So that's the public health service, and I think that will be fun having them around. Let's see, we're still raising funds. We've got a little bit further to go. My niece had set up a GoFundMe page, which has raised a few $1,000. We're in conversations at Needham Bank about a donation that they said that they could make to us. So I think we still have time, and we should be all set for that. We have some backup plans as well. So that shouldn't be an issue. Promotions are happening. Ed Hart has been out there. Today he was out talking to food pantries in different towns. He's been talking to boards of health. And so his activities have been increasing, and they'll continue from now until the beginning of the clinic. Steve Mitchell has been planning the menu. I saw a draft menu today, and it looked pretty much like it did last year. So pretty nice as RAM clinics go. And I think that's it. Ed, I just wanted to make sure we're all set with the parking lot.
Yeah, they said the paving's gonna hopefully not impact us at all. And then also, Jay, just so you know, on last Friday, I met with Addie Gibson, and she is trying to get a meeting scheduled with myself and her with the hospital CEO to see if he could potentially incentivize people to volunteer, especially registration and all those other entities that we also need. So I'm hoping that happens right at the beginning of next week. Excellent.
Yeah, that would be great. I'm just making a note here. Okay. And if you need me for anything, don't feel obligated to include me in that, but I'd be happy to participate if I can.
Yeah. And I don't know, Jay, did you have a chance to look to see how we are for the non-clinician register? I haven't looked for a while.
I didn't look at the numbers, general support.
Yeah.
I didn't look at the numbers, but I know that we've got about 7 pages worth of volunteers. So
Okay.
you remember
We're
what
doing
that
good.
looks like, right? So
Yeah, we're doing good.
yeah, we're doing okay.
Yeah.
And I think that's it. Dave, did you have
All right.
anything to add?
Not right now. I was planning on checking the website the next couple days, so I'm glad to hear you beat me to it and that the news is good.
Yep, it is. And like I said, if you can get a couple more optometrists or an ophthalmologist to join, that would be wonderful. But
Yeah.
you know,
And Jay, on that, we have a new one that just opened her practice in Wayland on Monday. I'm supposed to be meeting with her tomorrow, hopefully. So I'm going to head
all
over
right.
and see if they're available.
Oh, are you meeting with her for this, or you're
No, I was to welcome her to the community and going to rope her in at the same time.
all right, good. All right. Have your uniform on.
I will.
Thank you.
Jay, I have a question.
Sure.
My daughter, as I mentioned, that she's in Atlanta. She was willing to come and then help as a translator online.
Online, okay.
Yeah, she's a medical profession, but she said she can't do a medical thing because she's not licensed in Massachusetts. So
All right,
she will do a Spanish very well. So she's good.
All
at
right.
that.
I know that we didn't use that capability last year because we seem to have between Google Translate and the system that we had. I don't know if that was through the Metro West Medical Center. We were doing okay, but let me talk to Ram and see how they would pull that off. But I'll remember that she is available. And I'll get back to you so that she isn't waiting there for us.
Okay.
You know, but thank you very much.
Not a problem. You have my email ID, I presume, to reach out to me. Okay,
Yep.
Thank you.
Thanks. Okay, I think that's it. We
All
can
right, that's
move
it,
on if
Jay?
you want. Yep.
All right. Is the person that just joined us, are you from 272 Pond Street, the Mobil Mart?
He muted himself now.
You're muted.
Yeah, you can hear me now?
Yeah.
Yes, sir. Actually, my wife, she's the president of the business LLC. My name is Ankit Kumar Patel. And we are I'm the partner of the 5% of the LLC.
Okay. So are you here to represent that for tonight?
Yes, sir. Yes.
Okay. So so obviously you're here because of a sale of tobacco to a minor. Could you let us know how that happened and what measures you are taking to prevent that from happening again in the future?
All right, sir. So the thing happened, we just taken over the business 6 days before on 22nd of the May, right? Yeah, the 22nd of the May. And the previous company, he just deleted like all the records and all the procedure. They usually on the POS system, whenever we sell any tobacco or alcohol product, we usually scan or they pop up on the screen, make sure we check the IDs. But it's like when they leave it, they deleted like all the measures and everything. So after that, we install it all like tobacco product, and we have it like another business as well. So whenever we sell any tobacco product or alcohol, we scan it and we put in the system. Make sure we check it every single one's ID now.
Okay. And Raj, I'm just talking to our health director. Raj, have they paid their fine?
That is correct, sir. Yes.
Okay. So we never want to hurt our businesses, but we need to make sure that we're being safe, especially with our youth.
No, absolutely, sir. Like I definitely agree with the communities, because we not even want to sell any minors as well. And honestly, that's the manager. He has been with us with the 5 years. With the he is actually right now managing like boat store Holliston Expressway. It is on 815 Washington Street in Holliston, and he take care as well on 272 Pond LLC. And he's been 5 years with us, and we never got the violation. That's the first one in the 5 years,
Okay, and you do have a training program in place with any new employees you hire?
Yes, sir. Actually, we have the team of the 12 people with me right now, and they randomly coming in like every weekends, and they like do as a like our searching like our part of the compliance. Like he just standing there and they look and make sure he check every single one's IDs whenever he sell the tobacco product.
Any board members have any questions or comments?
I have a question. So was the training done? I know you said that you only had the store for 6 days prior to this. Was your training
Yeah.
done before you opened the store?
Not the training. So usually like we sell the tobacco product or alcohol. They usually come in on the screen, make sure the person is like over 18 or over 21, and we make sure check the ID. So that's the function was deleted, and now we install it. So since and we all the tobacco product, whenever you scan it in the POS system, they pop up on the screen and they just says make sure you check the person's ID and the person is like over age.
Okay.
Question: is there a provision if the system fails and you have a client there? How do you handle it?
You mean usually now he train and he knows in case that happen, let's in case we lost the power and the PO system not working. So if we do manually, so he now check it like every single person, like whenever he sell the tobacco product, he check it every single one's ID now.
So do you enter that in the system after you manually do it, or what?
Yeah, since like because like he's supposed to install the same what do you call the software like after the we taking over, but the previous company actually take it out or they deleted that function. So
I understand that. I understand, but if the system fails now,
right,
you have a provision to handle that, right?
Oh yeah, yes sir, yeah we do.
Okay, thank you. That's it.
Yeah, no problem.
And Mr. Ankit Kumar, I just want to correct you. I know you said age 18 is age 21. Again, just want to make sure, you know, so it's not age 18, it's over 21.
No, absolutely, sir. It is, yep. The usually, honestly, I tell you, like some of them store because I'm from Rhode Island. So still they showing us our somehow in our system says like the as a age as a 18, but the federal level is the 21. So we change it in all our system, like all tobacco product and alcohol is over 21 and older.
Right. I just want to make sure, you know, that hey, there is no lapse there in the
no, absolutely, sir. Yep.
You know? And you wanna be careful because there might be more checks given you had the sale, and the next fines are even more stringent. It's 2,000 with a 14-day suspension. You know, so just wanna bring that out.
No, absolutely. Be aware that, you know. So definitely, yep.
Thank you.
Yep, thank you, sir.
So we want to thank you for joining us tonight, and we wish you luck with your business here in Ashland.
No, thank you very much, sir. Actually, I thought that's we have to represent and the city also. We are actually downstairs of the city hall right now, you know, like town hall, you know.
Okay.
All right. Thank you.
Okay. Thank you for joining us.
Yep. Thank you.
Okay. All right. The next thing on the agenda, Raj, Health Director's report.
Thank you, sir. I was in a tobacco meeting, you know, at Framingham Health Department on Friday, June 21st. There are certain things came up, you know, it was for the whole collaborative and all the directors was there. We need to review our regulation. I know it was adopted only a couple of years back, but there are certain things the state is asking us, you know, to put in the regulation. One part is a lot of the tobacco companies, you know, they are using these enhancers, you know, or, you know, something with the taste, right? Given all flavored tobacco products are banned in Massachusetts. So they're trying to bring these enhancers, and that wording is not in our regulation. So what the state is recommending us to enforce, you know, any sort of enhancers that are used to put that in regulation. So we'll be reviewing our regulation, probably make some modifications, you know. And last meeting, Mr. KG said, you know, certain one more addition in the application. And there is one more I have noted during our meeting that we should change in our application. So will be reviewing both the application as well as the regulation. If any board member want to assist me with that, I'll appreciate that. If one particular person or any one of you want to do that, reviewing the new regulation or the modifications we should make to the regulation, I'll appreciate that. Please reach out to me if anybody have interest in doing that. Second item, we opened the cooling center at our community center on June 20th, given the heat event or high heat, and we'll continue doing so, during the whole summer season. If there are temperatures, if there are any advisories that, the state is going to issue, just to open the cooling center. So anybody without, don't have AC, we provide cold water there. And then, somebody who don't have AC during the normal business hours of the community center will be opening cooling centers. And we'll be putting that out to our social media. A couple of our food vendors establishments are going through change of ownership. Las Cabos is still pending, though they have submitted the application to us. I guess they're still waiting for the liquor transfer. And then Nick's Pizza next door to Town Hall, they also have a new owner. We had an application. We did a pre-opening inspection this last week, and they have some standing items that they need to correct, but other than that, they're good to go. Madras market, they're again restructuring, still in process. They are converting their grocery store back to the restaurant that they had prior to COVID, so they're going back there. Mill Pond Rest Home, only update I have that, they have an additional testing of the soil done for the leakage of oil that has happened a couple of months back. I don't have any update on the change of ownership there. Housing cases, we have picked up one housing case, rodent case at 55 Cordaville. Last week, we have a couple of complaints on this property. Me and Donna Walsh, our animal control inspector, we did inspection there. We found a lot of rodent activity. They had a chicken coop that was without permit. Before that, we have reached out to them a couple of times. We have sent a letter from our side, from the department. Then Donna also went for doing inspection that they never responded back to her. So since then, they have applied for the chicken permit, as well as today they have given us the pest control report that we have asked, along with other stuff that they need to do in the order to correct letter we sent them last week. So making some progress there. Chestnut Place Apartments, we have seen improvement again at their dumpster. A couple of pending cases still there. 137 Pond Street, I talked to Assistant Attorney General today through an email that they have asked me earlier, like last month or so, to give an affidavit to the court, regarding the situation there. Janice, the Assistant Attorney General, asked me to do some modification to that affidavit that she have sent it to me today, that I will review and sign it and send it back to her tomorrow. And hopefully, as she mentioned, they'll probably file that in court on Monday.
Raj, is that being reviewed by the town council to make sure?
That is correct, sir.
Thank you.
We did that, but like again, I am gonna meet Jen tomorrow. I'll run it through her. Last time when we did, it was vetted, and again,
sure.
I guess there was very minor modification. It came to me this evening itself, I'll look into what changes she have made, and we'll make sure before we send it out, we clear that,
Okay, thank you.
213 Trailside still, we have no more information from last time on the repairs on this property. With disease investigations, we have 3 active TB cases, out of which one of the TB cases, our public health nurse is doing home visits. The person is taking treatment or is on medication. Then there are 2 other cases that we are following up. Last item, we are doing some public health outreach, and again, she's doing a seminar kind of, or talk on heat-related events at a community center on July 18th. And she's doing another one at the Legis on type 2 diabetes that they have requested us to do. That is also this month. And a couple of things I sent it to Bolt today, regarding arbovirus. That's not on agenda. That we have our first mosquito sample, positive sample for West Nile for this year. That came out this afternoon. And one other thing I missed to put it on the agenda there was a event. It was a Indian event on June 16th. There was a 5-vendor event at Stone Park that was unpermitted, that we found out through a complaint on Facebook. That I've spoken to the organizers after the event. They came into the town hall, speak with her, and all the vendors have since applied the permits past date. We just wanted to make sure that we have data, in case there is any sickness or any related events, that what kind of foods they served and all that. So we had all their paperwork taken after the event.
And you had no prior knowledge of their being there without the permit.
That is correct, sir. No,
Correct.
and I mean, absolutely. I'm very specific.
Sure, that's right.
Should not have happened, Yeah.
Right.
So, but it seems the organizers was new. That's what I found out.
Yeah.
But they was here. A lot of us with me in the meeting, or 3 of them came to town hall to discuss, what transpired. So
yeah, it may be worthwhile if whoever owns the space, when they rent it or something, they should put a clause or something in their form, so that if there is a food being sold or being managed there, they should clear it with the Board of Health. That way, whoever rents it, they would know that they need to get the clearance.
Yes, sir. That also I have brought it to the attention of the management. They'll be addressing that.
Yeah, good. So that's easier. Every angle, like if I go in and rent in Ashland High School, they always ask me, where is the food permit? So we need to make sure that they're the ones who initiate it somewhere. Otherwise, the person who rents it may not know at all. So
I agree with you 100%, but I have brought it to the attention of the management to address that.
So, thank you.
Thank you, sir. Yes, and I'm open for any more questions from the board.
Raj, I was hoping maybe with Laura's assistance, maybe in the next couple of weeks, could you reach out to the organizers of the upcoming Ashland Day, which is going to be in September, and just reminding them that all of those food vendors will need permits?
I will positively do that, sir. Yes. So because
that way we get plenty of notice, plenty of time to work out any issues ahead of time.
In that regard, I do remember a past board meeting that happened in the library during John Featherston's chairmanship. There was some kind of a blanket approval was given. So you may want to revisit that minute. Laura may be able to pull out that and then see what the language was there. And if things have to be changed, we need to make sure that's nullified and then marked.
Right. This way, at least we have plenty of time to work on that.
Yes, I understand.
Yeah.
But that I just want to bring it because I was in that board meeting. I exactly don't know what the words were.
Sure.
It's better to refer to that and then make sure that we don't contradict or we change it.
Right. I remember that meeting too, HE.
What is it?
I remember that meeting too. And I think it was Bill Gath or somebody.
Correct.
Yes. Okay.
And then he was being supported by few others in the public. Okay. I know that.
Okay, I'll pull those up and get that wording.
Thanks, Laura.
Well, one more question I have, Raj. The cooling centers are not open on the weekends and holidays, I presume. Is that correct?
That is correct, sir. We don't have the kind of resources, that might be a bigger conversation we can have with, later on. But right now, we're just doing during the town hours, so.
Sure.
And we'll be doing it, given, maintenance of the property or overtime of the staff, that's a different conversation. And the only other thing, this topic have come up a lot I have attended maybe 5-6 meetings in past couple of months on heat related events, right?
Mm.
A lot of folks are setting this up, but the usage is very low, and same is the case in Ashland, right? We are setting this up but the output I'm getting, right, that the usage is very low, so we have to gauge, right, like if there is a need, to extend that after the business hours or over the weekend, so we just need to maybe do more studies,
Yeah, that could be because of unaffordable transportation. That's a possibility. People don't have car or something.
Absolutely. No,
Yeah.
I mean, I'm all for it, but I'm just saying, right, like
Yeah,
it has come up in the conversation, right? Like
right.
that's a little bigger topic to discuss, right? If we have to do that, how the town want to do that, but like I'm all for it. Just trust me, like for me,
definitely. Yeah.
That's something we should definitely do, right? From public health standpoint.
Sure.
Anybody else? All right, so the next thing on the agenda is the consent agenda, which includes the review of the Board of Health draft minutes from the May 7th meeting and review and approve the final fiscal year 24-25 year-to-date budget reports.
I may not vote the consent because 7th meeting I cannot participate in either if it has to be out or I'll abstain from the consent agenda voting. That's
okay.
Either one.
All right.
Either one.
So
the choice is the board's.
Sure. So do I have a motion from anybody?
Yeah, I'll make the motion to accept the consent agenda as written.
And I will second it. So all in favor?
Aye.
So we have 3 yeses and 1 abstention from KG for the minutes.
Correct.
Okay. So the next thing on the agenda is the discussion of future agenda items, meeting dates, review, tobacco regular and applications, 14 Acton Road septic system waiver, and August meeting dates. Raj, you want to take this one on?
Yes, sir. So as I mentioned, right now we'll be reviewing our tobacco regs. We need to do some modifications, changes to it. That will bring it to board maybe whenever, we're going to give some time to it to review and put that there, so that'll be up for discussion maybe in next meeting or so, or maybe one past that. 14 Acton, they gonna definitely have some waivers that are gonna ask from board. I'm currently reviewing that. I don't know if we need to put a meeting in between before we go to August. I'll let you know, but that might be something that need to go for repair. I mean, we got it last week or something like that, but I'm currently reviewing that and reach out to board in case there is any urgency. I know the board meets one time in July and August, but if you have any preference for August, let me know, or we can go to the first or second week, whatever the board prefers,
Do you want to do it now? Probably easier if we all know. I'm good for the 6th or the 13th. Actually the 13th might be better for me because I've got a wedding coming up. I don't know about you guys.
Do we want to plan August 6th, everyone? Is that good for everybody?
Sure. I think so. That's also good for before the clinic anyway.
Sure.
It is. And I can definitely make that work. If 13th works better for you guys, then it works better for me, but I can do the 6th.
Did you get that?
You enjoy the wedding, Jay.
Oh.
Are you sure?
I'm sure.
So that would mean we meet on the 13th?
Oh, no, on the 6th. I thought 6th was the date on which you have a wedding on the 6th?
Not on the 6th, but I've got a wedding on the 9th, and I'm just worried about what I'm going to be doing on the 6th. So I can make it work, but the 13th would be.
13th is fine for me. I'm not.
Fine for me too.
Yeah. Okay. Thanks, guys.
So August 13th, 6 p.m.
Yep. Okay.
How about David?
David, you good?
We don't ask Dave.
Sounds good to me. Yep.
Yeah,
I can make it.
Dave's just.
Yeah.
Silence is acceptance.
Yeah. Thanks.
All right. Well, with that being said, I will entertain a motion for adjournment.
So moved, sir.
I'll second.
Second. All in favor?
All right.
All right. Thanks, everybody.
Thank Thank you. Thank you very much, everybody.
Thank you.
All right. Good
All right.
night.
Have a good night.
Night.
Bye-bye. Good night.
Happy 4th, you know, if I don't see any one of you, enjoy.
Oh, yeah. You all enjoy the happy 4th. Good
Yes.
night.
Right.
Good.
Happy
Bye-bye.
Fourth.
Thank you.